Pulmonary vascular disease refers to a condition that affects the blood vessels connected to the lungs. This can lead to symptoms like difficulty breathing. Pulmonary vascular disease is a condition that affects the blood vessels between the heart and the lungs. The blood travels from the heart to the lungs and back again, constantly replenishing it with oxygen and releasing carbon dioxide. This process works like this. Oxygen-poor blood returns from the body's tissues through the veins back to the right side of the heart. The right heart pumps the oxygen-poor blood through the pulmonary arteries into the lungs, where it becomes filled with oxygen. The oxygen-rich blood then returns from the lungs back to the left side of the heart, and the left heart pumps the oxygen-rich blood into the body through the aorta and many other arteries. If any part of this heart-lung blood circuit becomes damaged or blocked, it can lead to pulmonary vascular disease. Pulmonary vascular disease can be caused by different factors depending on which blood vessels in the lungs are affected. There are several categories of pulmonary vascular disease. Pulmonary arterial hypertension. This is when there is increased blood pressure in the pulmonary arteries, which carry blood away from the heart to the lungs. It can be caused by lung disease, autoimmune disease, or heart failure. When the cause is unknown, it's called idiopathic pulmonary arterial hypertension. Pulmonary venous hypertension. This refers to increased blood pressure in the pulmonary veins, which carry blood away from the lungs to the heart. It is most often caused by congestive heart failure, and a damaged mitral valve in the heart may also contribute to pulmonary venous hypertension. Pulmonary embolism. This occurs when a blood clot breaks off from a deep vein, usually in the leg, and travels into the right heart before being pumped into the lungs. In rare cases, the embolism can be a large bubble of air or a ball of fat instead of a blood clot. Chronic thromboembolic disease. In rare instances, a blood clot to the lungs, pulmonary embolism, is not reabsorbed by the body. Instead, multiple small blood vessels in the lungs develop blood clots over time, gradually affecting a large part of the pulmonary arterial system. The symptoms of pulmonary vascular disease can vary depending on a few different factors. These include how suddenly the pulmonary blood vessels are affected, which specific pulmonary blood vessels are affected, how much of the pulmonary vascular system is affected. For example, a large pulmonary embolism blocking a major pulmonary artery can cause severe shortness of breath and chest pain, while a small one may cause no noticeable symptoms. Different causes of pulmonary vascular disease also have their own usual symptoms. Pulmonary arterial hypertension often causes slowly progressive shortness of breath. As it gets worse, chest pain or fainting with exertion can occur. Pulmonary embolism typically causes sudden shortness of breath, chest pain, and a rapid heart rate. Pulmonary venous hypertension also leads to shortness of breath, often worse while lying flat, with uncontrolled blood pressure, or when there is extra fluid in the body. When a person shows symptoms and signs that indicate pulmonary vascular disease, a doctor will need to conduct certain tests to make a diagnosis. These tests may include computed tomography, CT scan. This test uses multiple X-rays to create detailed images of the lungs and chest. It can detect pulmonary embolism and other lung problems. Ventilation/perfusion scan, V/Q scan. This nuclear medicine test compares images of how well the lungs fill with air to pictures of how well blood flows through the pulmonary blood vessels. It can help identify a pulmonary embolism. Echocardiography, echocardiogram. This test uses ultrasound to create a video of the beating heart and can help identify conditions contributing to pulmonary vascular disease. Right heart catheterization. In this test, a pressure sensor is inserted through a vein into the right heart and pulmonary artery to diagnose pulmonary arterial hypertension. Chest X-ray film. While a simple chest X-ray cannot diagnose pulmonary vascular disease, it can show contributing lung disease or enlarged pulmonary arteries. Pulmonary angiography, angiogram. This test involves injecting contrast dye into the blood and using X-rays to create detailed images of the pulmonary arterial system. It is very good at diagnosing pulmonary embolism. Now let's talk about the different treatments for pulmonary vascular disease. The treatment depends on the specific cause of the disease. For pulmonary embolism, blood clots in the lungs are usually treated with blood thinners such as batrixaban, enoxaparin, heparin, and warfarin. In serious cases of chronic thromboembolic disease, surgery may be needed to clear out the pulmonary arteries, along with the use of blood thinners. Riociguat is a drug that can be used after surgery or in those who can't have surgery, to help improve the ability to exercise. Several medicines are available to lower blood pressure in the pulmonary arteries for pulmonary arterial hypertension, such as ambrisentan, bosentan, epoprostenol, iloprost, and others. These drugs have been shown to improve idiopathic pulmonary arterial hypertension. For pulmonary venous hypertension, treatments for heart failure are usually appropriate, such as diuretics, angiotensin-converting enzyme (ACE) inhibitors, beta blockers, and vasodilators that reduce blood pressure. And if pulmonary vascular disease is caused by another condition, treating that condition might improve the pulmonary vascular disease. For example, autoimmune diseases are usually treated with drugs that suppress the immune system, while lung diseases with low blood oxygen levels may be treated with inhaled oxygen, nintedanib, and pirfenidone.